Every single day in operating rooms across this country, surgeons are busy patching up people who never should have been on that table in the first place. A tiny deposit of plaque, barely a speck on a standard scan, grows in total silence for years. Then, without warning, it ruptures, and your entire world collapses in seconds. Cardiovascular disease is the leading cause of death in every developed nation on this planet. It isn't cancer, and it isn't random accidents. It is the slow, managed decay of your blood vessels that will most likely kill you. And here is the reality. Most of you have absolutely no idea what is happening inside your own arteries right now. They aren't going to tell you the truth at your next scheduled appointment. The corporate medical machine is designed to profit from your continued sickness, not from your permanent health. If you want the unvarnished story the establishment tries to bury, you need to subscribe and hit like right now. We are building an underground community of truth seekers, and we need to hit our growth milestones to bypass the algorithms. Let us start with the most critical intelligence you need. 3 symptoms that mean you demand a specialist today. Not next week, not when it's convenient, today. The first red flag. You're climbing a few flights of stairs, or maybe clearing snow from the driveway. Suddenly, during that effort, you feel a distinct burning or a crushing squeeze in your chest. You stop, you catch your breath for a minute, and the sensation vanishes. You likely told yourself it was just fatigue, or maybe a bit of anxiety. You're wrong. That is classic exertional angina. In plain terms, it is chest pain triggered by physical demand that eases with rest. This is how coronary artery disease announces itself. Your coronary arteries are the fuel lines that feed the heart muscle. When those lines are narrowed by plaque, your heart gets just enough fuel to idle. But the moment you push the engine, your heart demands more than the narrow pipe can deliver. That pain is your heart screaming that it is in trouble. You need a cardiologist immediately. The second symptom is more insidious because it doesn't shout, it whispers. This is cerebral ischemia, starving the brain of blood. You might notice your thinking has become sluggish, or that tasks which used to be effortless now require a mental grind. But the true danger is the warning shot doctors call a TIA, a transient ischemic attack. One arm suddenly goes weak. One side of your face droops for a moment, or your words come out as garbled nonsense. It lasts 5 minutes and then it clears. And because it clears, most people ignore it. They convince themselves it was nothing. It wasn't nothing. A TIA is the flare sent up before a massive, life-altering ischemic stroke. Your brain is telling you a vessel is critically narrowed and the next event will be permanent. You need an ultrasound of your neck arteries or a CT angiography right now. The third symptom is atherosclerosis of the legs, and it shows up as intermittent claudication. This follows a very specific mechanical pattern. You walk 300 yards, maybe 500, and your calves start to burn and cramp like you've just run a marathon. You stop, the fire fades, and you keep walking. Most people write this off as being out of shape. It isn't. This is ischemia of the lower limbs. Your legs are being starved of oxygen because the pipes are clogged. You need a vascular surgeon and an ultrasound immediately. Here is a statistic that the industry won't put on a brochure. When severe leg ischemia progresses to the point of amputation, the 5-year survival rate is a staggering 10%. 9 out of 10 people who lose a limb to this disease are dead within 5 years. Not because of the surgery, but because they cannot survive the physical and psychological toll of the aftermath. That isn't a scare tactic. That is the documented reality of the pathology. If you feel that burning in your calves, you are in a biological emergency. Act now. Let's go deeper. You need to understand what atherosclerosis actually is, because the corporate version of the story is designed to keep you confused and compliant. First, you need to accept an uncomfortable truth. This condition is universal. Every single human being who lives long enough develops it. This isn't an exaggeration. I've talked to pathologists, the doctors who actually examine the machine after it stops. Not one of them has ever seen an aorta in a person over 60 that was clean. Not one. When a pathologist opens the aorta, the main highway leaving your heart, they run a blade along the inner wall to clear the blood. In a young person, that wall is white and smooth. But in a person over 60, it's covered in yellow, jagged deposits. Those are atherosclerotic plaques, and when the blade cuts through them, you can actually hear a crunch. That is the sound of calcium. It's the sound of your arteries turning to stone over decades of neglect and damage. Calcification is the proof that the plaque has been there for a very long time. Now, if you've had an ultrasound and they found a plaque, do not spiral into a panic. I've seen patients demand surgery for a 30% blockage because they were terrified. In most cases, that surgery isn't indicated. It is just a profitable distraction for the hospital. What you actually need to understand is why that plaque formed and what you must do to prevent it from becoming a catastrophe. In 15 years of clinical practice, I've seen the same pattern in the data over and over. Roughly 40% of the severe cases are smokers. Another 40% are diabetics. That accounts for 80% of the serious cases right there. Two enemies dominate this battlefield: tobacco and blood sugar. Let's kill one of the biggest myths in popular medicine right now. Cholesterol is not the villain. The industry has spent billions making you fear a substance that your body actually uses as a repair crew. When your vessel wall is injured, your body dispatches cholesterol to the site to seal the wound. It's the bandage, not the injury. If you want the cholesterol to stop piling up, you have to stop the damage that is calling the repair crew in the first place. Stop the injury, and the cholesterol has no reason to accumulate. So, what is causing the injury? Smoking is an obvious one. Toxins and tar from cigarette smoke enter the bloodstream and physically shred the delicate inner lining of your vessels year after year. That lining, the endothelium, is living tissue, not a passive pipe. But diabetes is the silent assassin. When your blood sugar is chronically high, your blood transforms into something closer to a thick, corrosive syrup. This process, called glycation, deforms your proteins and turns your vessel walls stiff and brittle from the inside out. It creates the perfect breeding ground for plaque. There is also a hormonal factor the establishment rarely discusses in detail. Before menopause, women have a biological shield, estrogen. It maintains vessel elasticity and keeps inflammation at bay. But when that shield drops, the rate of arterial decay accelerates to match the men almost immediately. Men, on the other hand, deal with a slower fade of testosterone, but they often smoke at higher rates and ignore the warning shots, which is why they tend to hit the operating table much earlier in life. The plaque grows slowly. It starts as a stable, dense deposit covered by a fibrous cap. It only becomes a killer at the exact moment it becomes inflamed. Inflammation makes the plaque soft and unstable. Think of an overripe fruit finally splitting open. The second that plaque ruptures, your body treats it like an open wound and sends a swarm of clotting proteins to the site. That clot, the thrombus, is what closes the pipe. If the artery is large, it's a partial blockage. If the artery is small, it closes completely. That is your heart attack. That is your stroke. And let's be precise about what an infarction actually is. It's death. It's tissue dying from a lack of blood. Whether it's in your heart or your brain, it's a failure of the fuel lines. The heart and brain just happen to be the most fragile because they are the least able to tolerate even a brief interruption in their blood supply. Think about the economics of this failure. A single stent to prop open a heart artery costs about $2,200. Removing a clot from a brain vessel, that runs about $8,800. Operating rooms are running these procedures 24 hours a day, 7 days a week. That is the true scale of cardiovascular disease in this country. And the vast majority of those patients could have avoided that table entirely if they had been given the truth instead of a prescription for symptom management. Let's talk about diagnosis, specifically how to catch this biological sabotage before it leads to a catastrophic event. The corporate gatekeepers will wait until you're having an emergency to run the expensive scans, but you need a tactical view of the bottlenecks right now. The most accessible and informative method is a carotid artery ultrasound. Why the neck? Because the industry knows that where arteries branch, the flow becomes turbulent. It's no longer smooth. It becomes a chaotic mechanical assault on the vessel walls. These high-stress zones are where plaques take hold first and most reliably. A simple ultrasound probe on your neck can visualize the vessel wall in real time, measuring the thickness and identifying plaques long before you ever feel a symptom. This isn't just prevention, it's biological reconnaissance. If a plaque is identified, the next step is a comprehensive lipidogram. But let me warn you, the basic cholesterol number your doctor circles on a standard lab report is a relic. It tells you almost nothing. You need the full breakdown: HDL, LDL, VLDL, and critically, lipoprotein A, written as Lp(a). Standard clinics rarely test for Lp(a) because it's an unambiguous clinical indicator for aggressive therapy, and they'd rather keep you on the wait and see plan. According to the latest high-level research, lipoprotein A is the single most important predictive factor for how fast your arteries will decay. If this number is elevated, the debate is over. You are standing on a landmine, and you need a strategy. Now, let's talk about the weapons we use to fight back. And I'm going to address the fear-mongering around medications directly. The first tool is ezetimibe. This isn't a statin. It works by blocking the reabsorption of cholesterol in your gut. Your liver produces cholesterol, dumps it into your intestine to digest fat, and then your body tries to recycle it. Ezetimibe cuts that recycling loop. It can slash your LDL by 50% with a side effect profile that is incredibly clean. For anyone in the early stages of this disease, it's an elite first-choice option the establishment often ignores. Then there are statins. The misinformation circulating about these drugs is genuinely dangerous, and it's being pushed by people who don't understand the anatomy of a rupture. Yes, there is data suggesting that high-dose statins over the long term might be linked to cognitive decline. I'm not dismissing that, but here is the cold clinical reality. If you have significant plaque and you refuse treatment because you're afraid of dementia, you are very likely not going to live long enough to develop it. A heart attack will take you off the board first. The real secret of statins isn't just that they lower your cholesterol numbers. It's that they are powerful anti-inflammatories. Remember, it's inflammation that makes a plaque soft and ready to explode. Statins stabilize that plaque. They cement the fibrous cap so it doesn't rupture. A stabilized plaque is a safe plaque. This is why statins save lives even in patients whose cholesterol levels aren't that high. Why do so many people have a horror story about statins? Because the system waits until after you've had a heart attack to prescribe them, and then they hammer you with maximum doses to stabilize the emergency. Those high doses carry real side effects, muscle pain and liver stress. But we can bypass that by being smarter than the standard prescribing software. By combining a low-dose statin with ezetimibe, you get the massive LDL reduction and the anti-inflammatory protection without the heavy drug burden and side effects. You get the benefit without the corporate overprescription fallout. Now, let's get into the 5 specific factors that are actively fueling the fire in your arteries. No amount of medication can outrun a lifestyle that is systematically destroying your vessel walls. Factor 1. Smoking. I am not going to waste your time with a generic lecture. It is chemical sabotage, plain and simple. Every time you light up, tobacco toxins enter your bloodstream and shred your endothelium day after day. If you smoke, stopping is the single most powerful biological intervention you can make. Nothing else in medicine comes close to the impact of this one action. Factor 2. High blood sugar. Whether it's type 2 diabetes or just a diet that's out of control, elevated glucose doesn't just make you tired, it destroys your microvessels. It kills your kidneys, ruins your vision, and turns your arteries into a breeding ground for plaque. It's not an adjustment, it's a survival requirement. Control the sugar, or the sugar will dictate your date of death. Factor 3. Hypertension. According to the latest large-scale research involving over 60,000 participants, this is the real heavyweight in the race to kill you. They call it the silent killer for a reason. You can walk around with a blood pressure of 160/100 and feel perfectly fine. You might even tell your doctor that running high is just your normal. It isn't. Inside your arteries, that pressure is remodeling your vessels into brittle, stiff pipes. A rigid artery is an injured artery, and an injured artery is where plaques take hold. Factor 4. Excess body weight. Let's kill the storage myth right now. Body fat is not just inert fuel. It is an endocrine organ. It actively pumps out pro-inflammatory cytokines, chemical signals that sustain a state of chronic inflammation throughout your body. That inflammation reaches your plaques and makes them soft and ready to explode. Furthermore, for every extra pound of fat, your heart is forced to pump blood through miles of new capillaries it wasn't designed to support. It is a state of mechanical and chemical overload that the human heart cannot sustain indefinitely. Factor 5. Chronic foci of infection. This is the one that surprises my patients every time because the specialists never look for it. Your dental health is a direct investment in the health of your brain. Years ago, researchers extracted clots from the brains of stroke victims and found that 60 to 70% of those clots contained oral flora, bacteria that live in untreated dental cavities. Those bacteria seeded the bloodstream, found a vulnerable plaque in the brain, triggered a local inflammatory storm, and caused the rupture. Go to the dentist. It isn't about your smile. It's a stroke prevention tactic. Now, what can you do that doesn't involve a pharmacy? Movement is your first prescription. Brisk walking, 10,000 steps a day, is the baseline. If you're short on time, use high-intensity interval training, HIIT. 5 minutes to warm up, then 30 seconds of absolute maximum effort, as hard as you can go, followed by 2 minutes of recovery. Repeat that cycle. Those brief peaks of exertion trigger a full circulatory and lymphatic response that a leisurely stroll will never reach. It opens insulin windows in your muscles, clearing glucose from your blood more efficiently than any pill on the market. Then there is temperature therapy. Cold showers and ice baths aren't just a trend. They are vascular exercise. Forcing your vessels to rapidly constrict and then dilate keeps the endothelium responsive and elastic. It's training for your pipes. Nutrition. Eliminate the refined carbohydrates. Your brain does not need sugar to function. It needs glucose, which your body is perfectly capable of synthesizing from protein and fat through gluconeogenesis. The cravings you feel when you cut sugar aren't a character flaw. They are a physiological withdrawal from a substance that targets the same reward pathways as addictive drugs. The withdrawal is temporary. The damage from the sugar is not. And finally, address the stress. Short-term stress is a survival tool. Chronic, unresolved stress, the kind that comes from a job you hate or a situation you refuse to change, is a biological poison. It keeps your cortisol and adrenaline spiked, driving your blood pressure up and keeping your plaques in a state of constant inflammation. Here's the tactical reality. The risk escalates massively after the age of 45. The decade between 40 and 50 is the critical window. If you wait until you're 60, you're already playing defense against a system in failure. I'm asking you again, how old are you? Put it in the comments. I need to know where you are in your life cycle so I can provide the right data for your specific risk profile. I want to leave you with a story about a patient I'll never forget. He was exactly 50 years old, wearing red silk socks, a detail you don't forget. He'd felt a crushing weight in his chest while driving and pulled into our ER just in time. While I was applying pressure to his groin after the procedure to save his life, he looked at me and asked if he was going to live. He told me about a family curse. Every man in his family had died at exactly 50. His grandfather, his father, his brother. I looked him in the eye and told him I was officially lifting the curse. That story isn't about fate. It's about a shared risk profile. They had the same genetics, the same lifestyle, and they all failed to intervene at age 40. Start your annual checkups at 40, full lipidograms, carotid ultrasounds, and you will almost certainly pass through that dangerous decade without hitting the operating table. The information I've given you today will not come up at your standard doctor's visit. The system is designed to treat the disease once it's profitable, not to prevent it while it's free. There is no billing code for keeping you healthy. That is why this channel exists. Subscribe to the channel, hit the like button, and help us build this community. The truth about your own biology is something you deserve to own. I'm Dr. Elias Thorne. I'll see you in the next one.